last year and I this one.
Okay.
Because I literally just got this one.
Okay, cool. Well, if you don't mind, let's talk at 12:30 and then I'll.
The Senate will please come to order. Today, for devotional exercises, we will have Reverend Becca Gorell of the United Community Church of Morrisville. Welcome.
Well, good morning.
Good morning.
In a coincidence and circumstance I could not have foreseen, I come to you this morning from literally next door to the incident that occurred in Morrisville last night and into today, outside my living room window. And so on a day that I had hoped to come bringing you blessings for peace and wisdom, I find myself just as much in need, if not more so, of such a prayer this morning. So thank you for the honor of being here, and thank you. I want to thank you public servants and the public servants of our great state for your care of our community, especially these past 18 hours or so. So I invite you first to take a couple of deep breaths, maybe not too deep. It is still COVID in our midst, but deep enough to marvel and give thanks for the gift of breath. And I invite you to join me in a spirit of openness and of peace before the higher power or God of your understanding or spirit of goodness in humanity. We give thanks. We give thanks to be here in this beautiful state, in this opportunity to serve one another as neighbors. Today, oh, force of love and life, we give thanks for public servants, be they senators or police officers or first responders, because today of all days we remember that we are first and foremost people, neighbors, community members, and friends. May we never forget the resilience and the hope that we draw from being neighbors and humans first. May we never take for granted the gift of community in our small towns and smallish cities across our state. And may we serve as colleagues and as neighbors in the midst of challenges and traumas and triumphs, so that peace and safety and well-being may be for all people, and especially for the people of the great state of Vermont. We give thanks and praise and ask for blessing in the name of God, in the name of love, in the name of life. Amen.
Thank you, and I think I can speak on behalf of everyone. Good luck and peace and love to you and your community. Thank you. Are there any announcements? Senator from Chittenden Central.
Thank you, Mr. President. I'll make this now, lest I forget it later. We'll have a brief Rules Committee meeting. So if the members of the Rules Committee could remain when we gavel out, we have a few things to take up, and we'll meet in seats 1 through 5 as always. Thank you, Mr. President.
Are there any further announcements? Senator from Washington.
Thank you, Mr. President. I believe this is the appropriate time. I move that the Committee on Finance be relieved of S-139, an act relating to the modernization of public safety communications in Vermont, and that the bill be recommitted to the Committee on Government Operations.
Now, the Senator from Washington has moved that the Committee on Finance be relieved of S-139, an act relating to the modernization of public safety communications in Vermont, and that the bill be committed to the Committee on Government Operations. Are you ready for the question? If so, all those in favor, please indicate by saying aye. Aye. Those opposed indicate by saying nay. The ayes have it, and you have moved to relieve the Committee of Finance of S-139 and to commit the bill to Government Operations. Are there any further announcements? Seeing none, there are 3 bills on the calendar for notice to be referred under Rule 31. The first bill, H-77, affecting the revenues of the state, will be referred to the Committee on Finance. H-86, impacting the revenues of the state, will be referred to the Committee on Finance. And H-479, affecting the expenditures of the state, will be referred to the Committee on Appropriations. We have, although I don't know where my sheet went. One moment. We have one bill for introduction, S-148, introduced by the Committee on Health and Welfare. Please listen to the first reading of the bill.
S-148, an act relating to childcare and early childhood education.
Now you've heard the first reading of the bill, and being a committee bill, will be placed on the calendar for notice. We have a House bill for reference, H-489. It was introduced by Representatives Brumsted and Lally. Excuse me if I've mispronounced that. Please listen to the first reading of the bill.
H-489, an act relating to approval of an amendment to the charter of the town of Shelburne.
Now that bill, having not been received by crossover, will be referred to Committee on Rules. That brings us to the orders of the day. Our first bill for reference today is S-146. S-46 was read the first time and referred to the Committee on Natural Resources and Energy, which considered the same, and I believe recommend the bill ought to pass. The bill was then referred to the Committee on Finance, which also considered the same. Please listen to the second reading of the bill.
S-146, an act relating to the permitting of indirect discharges.
I apologize, that was a committee bill, and so it was never referenced to the committee. It was introduced by the committee, and now for the report from the committee, the senator from Addison, Senator Bray.
Thank you, Mr. President. Again, I'm reporting on S-146. Copies of the bill will be distributed to members, and there's also a handout to follow. So S-146, and it's an act relating to the permitting of indirect discharges. Sometimes we look at a bill, or we're working on a bill because there's an opportunity that we want to seize on. Other times there's a problem that we want to remedy. And in this case, there's both going on in this bill. We have statutes related to water quality rules and septic system dating to 1986. And we have been working to receive a rule on anti-degradation, which means maintaining water quality, an anti-degradation rule that goes hand in hand with statute, and that's been under development since 2005. So S-146 will modernize and improve the Agency of Natural Resources permitting of indirect discharges, wastewater systems, etc., as well as streamline the water reclassification process in order to protect very high quality waters based on water quality data and the use of waters. This extra protection will ensure that the most pristine waters of the state will remain protected, but it also allows for development and upgrades to repairs of existing water infrastructure in very high water quality watersheds. Currently, the waters of the state are designated by classes. A and B, they're subdivided, and they represent the quality of water, and therefore the level of protection that those waters must receive to avoid degradation. And again, how we avoid that degradation or diminishment of water quality is specified in a rule that is currently being moved through the process, and LCAR, I believe, we'll see within 2 months. And we'll come back to that at the very end of the bill. The bill broadly has two primary parts, and that is to reform and improve an antiquated prohibition related to indirect discharges in Class A waters, so the highest quality waters, and coupled with an improved permitting process that looks at each specific project's impact on the affected water. And it streamlines the A&R's reclassification process so waters that should be afforded X protection to maintain their status can receive those protections. So the opportunity part of this is that currently based on water quality, so lakes and streams should be classified based on their water quality. There's objective sets of measurable properties of the water and its use and function, and the ability to take waters of the state and reclassify them to these higher levels of quality is being held up by a perceived problem related to being reclassified. So namely, there's 120 plus lakes and streams that could be reclassified to A based on their current level of water quality. There is, on some occasions when these reclassifications are proposed, local concern that when you're reclassified to a higher level, Class A, which is desirable because then management of that watershed helps protect that water quality. But the concern is that there's a 1986 statute that says that you can't have a septic system greater than 1,000 gallons per day in a Class A watershed. So for many of these regions where the 125 opportunities to reclassify and then better manage water quality, there is local concern that now they'll be brought into this septic prohibition, and they will have concerns about, can they replace their system, or could they have a septic system larger than 1,000 gallons, which is prohibited. The solution to this situation is to do two things in tandem. One is to improve the permitting process that the Agency of Natural Resources will implement. That is the so-called anti-degradation rule. And this goes hand in hand with changing the statute that has this 1,000-gallon prohibition built into it. And let me pause to refer people to the handout before going through the bill. Because it's, although there's complexity and subtlety between the statute and the rule, maybe if we look at it as a picture, it's easier to see what's going on. So the upper box there labeled today shows what kind of permitting happens for what kind of septic system based on gallons per day. If you are currently in a Class A water, you can have a septic system permitted up to 1,000 gallons. And anything larger than that is simply not allowed. If you're in a Class B water, which is the vast majority of the state's waters, you fall into this paradigm where you have an on-site permit issued for gallonages up to 6,500, and then you go to a related indirect discharge permit for anything over 6,500. Under S-146 in the lower box, we address this concern about Class A waters by doing two things. For Class A waters that are the most pristine and that are at an elevation of 2,500 feet or higher, they stay in the current protective scheme, which doesn't allow septic systems larger than 1,000 gallons per day. But for Class A waters, these would all be the newly reclassified waters, the 125 lakes and streams that, based on their physical characteristics, merit that classification. They now receive the same treatment that you can see that we've had for Class B. So, namely, that in those waters, you use an on-site permit, and it goes all the way up to 6,500 gallons. Anything above that, you use an indirect discharge permit. Class B waters, shown right below, remain unchanged. So that is the solution to allowing us to permit in those areas and therefore provide assurance to people in the watersheds where these Class A waters are, that they will now be permitted in the very same way that they are under Class B and a Class B water. So that's, again, it's an opportunity to simplify and clarify how we manage those waters. So let me turn to the bill itself and just walk through. Section 1 summarizes the background and purpose of the bill. So namely, the Clean Water Act in Vermont is the delegated authority by the EPA to enact the Clean Water Act. Requires states to adopt an anti-degradation policy and the requirements for implementation. ANR, as I've noted, has initiated rulemaking for the anti-degradation rule, and it's we expect to see it within approximately 2 months at LPAR. And this bill is tied in terms of its effective date to that rule coming into effect, because as I was saying, they really go hand in glove. The ANR anti-degradation implementation rule will ensure that the level of water quality necessary to support the uses of state waters shall be maintained, and water shall be managed to minimize risk to existing and designated uses of those waters. The rule also clarifies how proposed new discharges will be reviewed and permitted by ANR. The ANR, this implementation rule that I've been mentioning, also requires a consideration of cumulative impacts to the receiving waters during the evaluation. And it also proposes that ANR will propose to reclassify waters where water quality data meets or exceeds the minimum criteria for higher class for one or more designated uses to allow for the protection and maintenance of those waters. So in section 2, we get into we start into the more technical provisions of the law. And that is, currently a person is prohibited from discharging waste into Class A waters except for an on-site wastewater system with a capacity of 1,000 gallons per day or less, unless they have an existing system with an indirect discharge permit. The law also prevents ANR from reclassifying Class B waters that are high quality to Class A because there may already be development in the watershed that exceeds 1,000 gallons, and they don't have an indirect discharge permit. So one of the challenges with this 1,000-gallon 1986 level, it's actually arbitrary, and it's not based on science of the system itself, the watershed, and the receiving soils where the system would be installed. So the new rule uses all those criteria. So it looks at the quality of the soils, the design of the system, and it must be an engineered, professionally engineered system. And it looks at the watershed overall, and then it looks at how an addition of yet another system, septic system, would affect any possible cumulative impacts for the watershed as a whole. In section 3, we clean up some obsolete or confusing language under the indirect discharge permit requirements. And in section 4, we move on to wastewater permits. So it amends the statute relating to the issuance of on-site wastewater permits, septic permits that we've been discussing. And as I mentioned, ANR relies on certifications from professional engineers and site designers when they permit such systems. We do take the extra caution here of providing that when an on-site wastewater system of over 1,000 gallons in a Class A or Class B1 water, the higher quality water, ANR will review these applications, and if required, the secretary can undertake additional analysis to ensure that we're maintaining the protection of those waters. Section 5 directs ANR during a triennial rulemaking for the water quality standards to propose to reclassify any waters where the water quality data meets or exceeds the minimum criteria for higher quality waters. And in the event that triennial rulemaking does not occur, ANR will propose to reclassify any waters where that water quality data meets or exceeds the minimum criteria. Because we're moving to a new paradigm, and I think we're in trust but verify mode, we have a report in section 6, beginning on January 15, 2024, and biennially thereafter. ANR shall report to the General Assembly of the status of very high quality waters. For instance, it was very much of interest to the committee that if we're facilitating the permitting, that we also see the reclassification of the 120 or so waters that are eligible for being classified at this higher level and managed to a higher level of water quality. This doesn't represent, I'll leave it at that. And the report that we're going to receive back includes a listing of the waters where water quality data meets or exceeds the criteria for higher classifications. Secondly, it provides ANR's observations about whether the General Assembly's decision to shift from the 1,000 gallons per day older arbitrary limit actually improves the Secretary's overall ability to reclassify waters. It also requires a report out on the number of wastewater system permits and other discharge permits issued in very high quality waters. And finally, progress made on and difficulties encountered during reclassification of waters. There's also in section 7, a non-point source pollution stakeholder group formed. So it directs that the Agency of Natural Resources, in consultation with the Secretary of Agriculture, convenes a working group to review, investigate, and make recommendations regarding the state's anti-degradation policy as it relates to non-point source pollution in high quality waters. So if the number of high quality waters is going to be expanded through reclassification, we also want to see interaction between different sets of water quality rules in order to ensure that they're compatible. In section 8, we get to effective dates, and the section 7, the non-point stakeholder group section takes effect on passage, but the rest of the sections take effect on the effective date of the ANR anti-degradation implementation rule that I've been mentioning. So we don't trigger the new review process until we have the new rule in place and legally functioning, because again, one works hand in glove with the other. I've said a lot. There's a lot of complexity and nuance to water quality law and actual management. But if you want to distill it all down to the heart of what's changing, I'd go back to the homegrown graphic that I passed out. We say that for water quality, Class A waters at 2,500 feet or above, as we currently do, we are more protective of them. These are often high mountain streams and lakes. So we want to maintain them as much as possible in the pristine condition. Protection for those remains unchanged, but below 2,500 feet, we move to a newer, rigorous permitting system that will examine the actual conditions on the ground as well as the septic design itself in order to allow the development, but also ensure that it's not going to have a negative impact on waters. So that's for newly classified Class A waters, and then Class B waters remain unchanged. That completes my report. Thank you, Mr. President. Oh, I'm sorry, it does not quite complete my report. Let me review for people from whom we heard and developing the bill. We worked with and heard from Water Protection Advocate Jared Carpenter, MMR lobbyist Warren Coleman, Policy and Program Director of the Vermont Natural Resources Council, John Groveman, the Director of the Watershed Management Division of the Department of Environmental Conservation, Peter Laflamme, Strategic Advisor and Engineer at Van Hess, Hangen and Bruston, Jeff Nelson, Deputy Chief Counsel Michael O'Grady, Staff Attorney with the Conservation Law Foundation, Mason Overstreet, Monitoring and Assessment Program Manager of the Watershed Management Division at ANR, Bethany Sargent, and the Associate General Counsel of ANR, Hannah Smith.
And Senator from Madison, you'll also be recognized for the report for the Finance Committee.
Thank you, Mr. President. The Finance Committee reviewed the bill and found that because all of the current activity in these watersheds is already permitted and people are just they will remain permitted, there will likely be no impact on the revenues of the state. And we recommend the bill with a vote of 6-0-1.
Question now is, shall the bill be read a third time? Senator from Rutland.
Thank you, Mr. President. May I interrogate the reporter?
The senator from Addison is interrogated as the reporter of the bill.
I have some property that's from 2,400 to 2,800 feet elevation. Have a hunting camp on it with an approved septic system. Well, actually, it was before there was any approval required. So if this bill passes, is that septic system going to be grandfathered, or will it have to be re-permitted?
Yeah, thank you for that question. So this bill is effective going forward. So existing uses remain unchanged.
So to continue, I have also have got an Act 250 permit to log my property because some of the property is the timber is above 2,500 feet. Will the current Act 250 permit be suffice for me to cut those logs?
So S-146 has no impact on the regulation of forest.
Okay, so it does not affect acceptable management practices or agricultural practices?
For agricultural practices, and S-146 does not have any impact on those as well.
You said Act 146?
I'm sorry, S-146.
Okay.
So outside of this bill related to permits for septic systems are those two bodies of law that you're referring to. I think there's accepted management practices, sometimes called the Orange Book for forestry, and then there's the required agricultural practices, the RAPs that relate to farming. But this bill does not change any provision in those bodies of law.
And if I may, Mr. President, one more question. So did you have any, did anybody testify from the ANR?
Yes, we worked extensively with the Agency of Natural Resources. So that included their Associate General Counsel, Hannah Smith, Pete Laflamme, the Director of the Water Management Division, and Bethany Sargent, the Monitoring and Assessment Program Manager.
Thank you, Mr. President. That's all I have.
Senator from Orleans.
Yeah, thank you, Mr. President. May I inquire of the reporter?
The reporter is interrogated.
And my concerns are with Section 7 of the bill. And this was not brought to ag by the Natural Resources Committee. And I have chatted with the chair of the committee, but the working group, I mean, you've got both the Secretary of Ag, Secretary of Natural Resources, but the working group is not mentioned that they're supposed to call together. And so I'd like to know who the working group is and how many meetings they're gonna have, because that's not mentioned, as well as, you know, when you gave your list of reports, I didn't hear anything about Farm Bureau coming in, rural Vermont coming in, or any farmers coming in to testify in regards to the required ag practices. So could you answer those questions, and then maybe we'll get to some others?
Sure. You know, I'm not, I realize when I look at the list of witnesses that is officially on our computer system, we also...
Pick up the tone a little, please.
We did have the Agency of Agriculture, Food and Markets in the committee. And I'm not sure why, when the printout was generated off the computer system, that that witness does not appear. But we did have a Agency of Agriculture, Food and Markets in when we were working on this section of the bill. As for the membership of the stakeholder group, we're leaving it to the discretion of the two secretaries in order to decide from whom they should hear, in order to have a discussion about the various elements that they're asked to report on.
And Mr. President, could the reporter explain to us if you're farming and you have to meet the required ag practices, how much non-point source pollution can a farmer discharge from his farm?
I wouldn't answer, I wouldn't hazard a guess on the requirements of the RAPs. In this case, what we're saying is we're putting into place a new anti-degradation rule and a statute designed to facilitate the implementation of that rule. And what we're asking the two secretaries to do is examine how this rule may or may not have any connection to two other aspects of activity out on the land, namely farming and forestry.
Mr. President, you know, I've been on ag for quite a few years and dealt with most all of these rules and regulations as they came along. And farmers have to meet the required ag practices. And one of those issues that they have to meet is that there's no runoff from that property on that farm to any waters of the state. And that's milk house waste, silage waste, manure pit waste, any waste. And if a farmer does have any discharge, then they aren't meeting the RAPs and they have to stop producing milk and working their farm. So I mean, there was one person from ag that testified before the committee. Is that right, Mr.
That is correct.
And did that individual support the measures that you have in this bill?
I'm really, to be fair, I wouldn't want to characterize their response in terms of support or lack of support. I don't think what we did here was that they were busy and they had some concern about being involved in any other reporting requirement.
And the other, I'll get back to that particular issue. But the timber part down on page 7, about there's many people that own small farms especially, but all farms own timberland. And the smaller farmers, they usually sugar in the spring, and in the fall sometimes when taxes come due, they go and cut timber off their forest management plan. And in one of these sections, the AMPs, they're going to have to notify whether to require these small farmers or small woodlot owners to report to the state before they can go and cut. What is the purpose of that particular language in this bill? Do we have a problem with small cutters going in? Are you going to exempt out people with less than 200 acres or whatever? But really, what's the purpose of that particular section?
So I want to reiterate that these are questions being asked of the two secretaries to provide some review and analysis of, because with the reclassification of waters and the implementation of an anti-degradation rule, there may be places where the rule will abut or include land currently in either forestry or farming practice. So what we're looking for is the two secretaries to determine whether or not these programs are complementary and well-designed. We don't assert anything other than that we have a question and we'd like them to examine it.
Well, I'm sure they're going to really welcome, I mean, the working group is probably going to be made up of the same group that we heard that testified. And most of those people don't have much to do all summer, and they're going to be on the working group. And you know, I can just see that coming back with, oh yes, we need to get these people to report if they're cutting any of their timber. And it just boggles my mind that we constantly, thank you, member. It boggles my mind that we, you know, keep moving along and we got a bunch of meetings coming up from this and reports coming, and our state workers that we have to keep adding more workers because we add more work for them to do. And then we run out of money, so then we have to tax the people to get more money in order to pay more employees to do more studies that we require. And then we go home and wonder why the people back home wonder why their taxes are going up. And last summer, I spent, I don't know how many days, but it was quite a few of them, going to meetings. I'm lucky that I don't have to work any longer. So I could go to these meetings, and we asked the council to try to figure out how much all these rules and regulations that we have here in Vermont, how much does that add to the price of milk that we have to compete against selling in the markets in southern New England? So New York, Massachusetts, New Hampshire, Connecticut, Maine, and Rhode Island. And it costs our farmers today roughly $1.70 a hundredweight more to produce their milk on Vermont farms because of our rules and regulations compared to the other states within our region that we're competing with to get our milk in. And then we wonder, we scratch our head in ag some days and say, well, we've lost 100 farms in the last couple of years. I wonder why. Is the price not high enough? Well, you can't keep taking more from the milk checks and putting it into things like what we're talking about again this morning, into issues that are going to cost our guys more money and still be competitive in the marketplace. And I'm really not too, as you can probably tell, too happy with this proposal. And if I had an environmental issue in my committee that I was working on, I would at least invite the chair of the Natural Resources Committee to come in and look at it and see what they thought. But that didn't happen in this particular case. And I think between the loggers, which we do not have any jurisdiction, but they're going to be upset with this. I know the ag community is upset with this, and I don't even know where this came from, and we weren't told where it came from, but it certainly didn't come from the Agency of Ag to look over whether the RAPs are adequate. If you look at the runoff stuff in the state of Vermont and our water qualities, you'll also find that about 80% of all the cleanup so far in our watersheds are that's being done by farmers. And you can't beat a horse to death and expect them to keep working. So, just wanted to relay my thoughts on that.
Senator from Madison.
Thank you, Mr. President. I just want to share some information with the room. So again, I'm going to turn to the bill itself, and I'm looking at Section 7, Non-Point Source Pollution Stakeholder Group Report. There is created a working group. The Secretary, meaning the Secretary of Agency of Natural Resources, in consultation with the Secretary of Agriculture, Food and Markets, shall convene a non-point source pollution in Class A and B1 water stakeholder group to review, investigate, and make recommendations regarding the state anti-degradation policy as it relates to non-point source pollution in high-quality water. So I'm counting on the Secretary of the Secretaries of the Agency of Natural Resources and the Secretary of Agriculture to assemble a viable working group that reflects the interests of all parties potentially affected. I'll reiterate again that this bill makes no changes to the required agricultural practices, makes no changes to the accepted management practices that apply to forestry. Having lived for 20 plus years until recently on a working farm in New Hampshire, included a 60-acre woodlot on which the various activities that the chair referred to, cutting for firewood, sugaring, as well as recreation. I'm very familiar with operations of the farm and the needs of people to operate. But again, we're drawing no conclusions about how the anti-degradation rules and the non-point source pollution rules should coexist. We just want to know that there is a good complementary relationship that doesn't leave gaps.
Senator from Essex.
Thank you, Mr. President. Can I inquire the reporter of the bill, please, Mr.
Senator from Addison is interrogated as the reporter of the bill.
In our area of the world and a lot of other areas of the state, homeowners rely on septic systems to make sure that they're keeping the waters of the state clean and resourceful. I'm just really struggling with a lot of the language of this bill, wondering where it came from to begin with and where the problem was even recognized and where any of this would come forth. But so houses and septic sizes are determined by bedroom counts. You could have 57 bathrooms in a home, but it really is down to bedroom size. Is this bill regulating housing as much as anything? We hear about the ag. My seatmate from Orleans talks about ag, but is this regulating housing as well?
There is a relationship, of course, between septic permits and development of housing. But I would say to the extent, so yes, there is a connection, and I would say that what this bill does is that for Class A waters, which currently limit septic systems and have done so since 1986 to a maximum of 1,000 gallons per day, that such housing, either existing or new under S 146, if they're below an elevation of 2,500 feet, which I think is vast majority of development, that they would now be allowed the provisions that would actually set no limit to the size of their septic system, but just require a permit, as is current law, but allow them to have a permit of any size, and depending on the size of it, they would either get an on-site permit or an indirect discharge permit, both of which is existing law.
Where my confusion comes from is each bedroom is allowed to emit 150 gallons a day. Most of the houses that I deal with seem to be 3-bedroom homes, so the septic permits, you typically read that they're 450 gallons of discharge per day. And where I get really lost with this is we start talking about septic tank size, I think, and we're talking about 1,000-gallon tank sizes, which seems to be the standard size tank that we're seeing in these private homes. And the tank has nothing to do with the discharge amounts. It only holds the waste and then lets the water separate from the waste and then goes into a leach field, and that disperses the water. Are we talking about homes that are only 6 bedrooms or more, which would put it at the 1,000-gallon discharge per day, or are we talking about tank size?
We're talking about the system design size, so how many gallons per day that system can accept.
So we're talking, so the 1,000 that you reference on the, Mr. President, on the chart that we see right here, we see the 1,000. Is that 1,000 gallons of discharge a day? Or is that 1,000-gallon tank size?
That's a system designed to process 1,000 gallons per day. I'd have to get more information on the tank size. It's the design, it's the capacity of the system.
Mr. President, when all this testimony, what I didn't hear from the presenter of the bill was any engineer or anybody that engineers septic systems that were legally licensed within the state, were they consulted about any part of this bill?
Yes, they were.
Okay, and then they were witness. I didn't hear them on the witness list. They were on the witness, Mr. President, on the witness list.
Mr. Nelson is an engineer. I would also say that the Agency of Natural Resources, by virtue of the fact that it works process applications, brings a lot of engineering expertise to the table when they provide testimony.
So as it stands right now, if a homeowner, Mr. President, has a problem with a septic tank, which would be likely a 1,000-gallon tank, under their permit that they're issued, wastewater permit they're issued with the state, they're allowed to replace that tank without getting a permit reissued by the state. If they fool with the disbursement field, or what we would call a leach field, That's not allowed. They have to get relicensed with the state. They have to bring the state engineers in or their own engineers in, but the state gets involved. Would a homeowner now, if they had a defective 1,000-gallon septic tank, would they be able to replace that now without getting a permit reissued?
I would like to double check with the council on the exact provisions, but we're not changing any threshold related to the 1,000-gallon tank. And this bill is to address new systems going forward. Well, let me leave it at that. If you want more details about situations where there's tank system failure or replacement, I'd be happy to either pause and get that answer now or have a more precise answer for you before third reading.
Before third reading, Mr. President, would be fine. We're spending millions of dollars in this state to try to build more housing. Did we bring anybody into the committee to find out how this would impact new housing builds or restoration of other housing? Did anybody testify to your committee how it would impact them and costs and anything like that?
We did not have testimony on that. You know, it actually, I think the informal discussion, not from members of the housing community, actually pointed out that by virtue of this change, namely that only for systems above 2,500 feet were they still subject to the strict 1,000 gallon per day limit, that we were creating opportunities for development at 2,500 feet and below. There's no limit specified. However, it has to be an engineered system, and that's been current law all along.
I thank the Senator. Mr. President, I'm with my seatmate on this, my senator from Orleans. I just can't understand why, when we have things that work just fine, why are we just going to make it tougher here? Why are we going to make it more expensive? Why are we going to bring government into people's lives more and more and more and regulate and study and just make it more difficult for the average person to live in this state? It just doesn't make any sense to me, Mr. President. Why we just keep on regulating and regulating and regulating. This bill comes out of left field as far as I'm concerned, Mr. President. It just there's nobody coming here demanding that we do something. There's no public outcry. It's just one little thing where we just tighten the noose just a little bit more, just a little bit more, just a little bit more. And what that does overall, and I know there's probably folks that don't believe this, but it does make an impact on what we can build for housing here, what we can do. I mean, we just regulate and regulate and regulate and regulate and regulate. Pretty soon somebody says, "The heck with that, I'm just not going to do that." And it's very, very frustrating. It's very frustrating to go around and now, as far as in my business of real estate, to really have to look at some of this stuff, which we pay close attention to septics and to make sure they're performing correctly. And it's just another layer of cost and worry that now we have this right here. We don't even know what type of rules they're going to come up with, because we got this study committee that's going to come up with people who really don't have much time to do other than to make it tougher with the state. It just really makes me wonder why we need something like this when there's no public outcry, nobody's demanding it, nobody said that we got to change it. It's just one more notch in the belt to put it tighter around the public's neck to make it more expensive to live in this state. Thank you, Mr. President.
Senator from Washington.
Thank you, Mr. President. If any of you read Digger this morning, you know I'm a retired realtor. And I'm also chair of finance. This bill was presented to finance. And I thought I understood this bill until I sat listening to the concerns on the floor. The way I understand it is we have Class A waters and we have Class B waters. Some of those Class Bs, and there's B1 sub Roman S3 or something, but some of those Class B waters are in pristine enough shape So we could move them up to Class A. But if we move, the thing stopping that is the concern that there is a limit of the 1,000 gallons of discharge a day that is in Class A waters. And so what this bill does, and I'm looking to be corrected, is it says, if we take a B water and we make it an A, the present septic requirements for a house or a future house in a B area remains the same as it is. So you can have clear water and not have to upgrade your septic. That's, I think, why we voted it out of finance, but I stand to be corrected.
Senator from Madison.
Thank you, Mr. President. I'd say the chair of Senate Finance has accurately characterized what we're doing. I also want to mention the idea that there's some sort of government overreach or excess ambition to regulate. The Clean Water Act was passed 50 plus years ago. Vermont is delegated authority to carry out the provisions of the Clean Water Act because they're delegated by the EPA. It's a requirement that, a legal requirement, federal requirement, that any delegated state follow the EPA guidelines, and one of which is that we shall have a program that addresses degradation of state waters by creating an anti-degradation program.
The question is, shall the bill be read a third time? Are you ready for that question? If so, all those in favor, please indicate by saying aye. Aye. Those opposed indicate by saying nay.
No.
The ayes appear to have it. The ayes do have it, and you've ordered third reading of S 146. We now have up for consideration H 418. H 418 was read for the first time and referred to the Committee on Government Operations, which consider the same and recommends that the bill ought to pass. Please listen to the second reading of the bill.
H 418, an act relating to approval of an amendment to the charter of the town of Barry.
Now you've heard the second reading of the bill, and for the report from the Committee on Government Operations, the Senator from Washington, Senator Watson.
Thank you, Mr. President. H 418 is a charter amendment for the town of Barry, which does two things. It moves constables from being an elected position to a position appointed by the select board. Secondly, it eliminates 3 listers and transfers the responsibilities of the listers to the assessor, which is already a position appointed by the select board. By moving a constable to an appointed position, the select board may adjust the constable's duties based on whether or not the constable is a certified law enforcement officer. In regards to listers, the town of Barry hasn't had elected listers since at least 1996, and since they have an appointed assessor, this change would bring their charter in alignment with current practice. The Barrytown vote count on the question of the constable portion was 659 yes to 157 no, and the vote count on the lister question was 667 yes and 153 no, with 13.6% turnout of registered voters. So to the specifics of the bill, Section 1 says that the General Assembly approves this charter amendment and that the voters of the town approved the changes on May 10th, 2022. Section 2 outlines the specific language changes of the charter of the town of Barry. Specifically, it removes the reference to 3 listers and 1 constable from the officers that shall be elected by the voters of Barry Town. It removes the portions of the charter that outline the duties and procedures regarding the listers and constables. And then to the section about the assessor being appointed, it adds that the assessor shall perform all duties of listers as described by state law. It adds constables to the list of appointed officers, and then it goes on to describe the duties and procedures having to do with the constable. Section 3 is about the transition to the new charter. It outlines that the current constable will continue until a new constable is appointed by the select board, and the lister positions shall cease to exist, and the terms expire upon the effective date of this bill, which should be just fine because there are currently no listers serving the town of Barry. Section 4 is the effective date, and this act shall take effect on passage. And we heard from Tucker Anderson of Legislative Council, Ashley Angel, law clerk with Legislative Council, Representative Michael Marwicki, who reported the bill in the House, and Captain Paul White, who's the chairman of the Barrytown Select Board. The Senate Government Operations Committee found this bill favorable with 6-0 vote and asked for the support of the Senate. Thanks.
Question now is, shall the bill be read a third time? Are you ready for the question? If so, all those in favor, please indicate by saying aye. Aye. Those opposed indicate by saying nay. The ayes have it, and you've ordered third reading of H418. We now have up for consideration H222. H222 was read for the first time, referred to the Committee on Health and Welfare, which considered that when amended, the bill ought to pass. The bill was then referred to the Committee on Appropriations that also recommends that when amended, the bill ought to pass. Please listen to the second reading of the bill.
H222, an act relating to reducing overdoses.
Now you've heard the second reading of the bill. For the Committee on report of the Committee on Health and Welfare, the Senator from Addison, Senator Hardy.
Thank you, Mr. President. The bill is being passed out to you, and also, I believe, a chart for your reference that I will reference in my report. Excuse me. H222, as the President said, is an act aimed at reducing overdose deaths from opioid addiction. In 2022, 237 Vermonters died of opioid overdoses, setting a record for the number of annual opioid deaths in our state, after the 2 previous years also set a record for the number of opioid deaths in our state, at 217 and 158 deaths, respectively. Like many challenges in Vermont, the opioid crisis has deepened during the pandemic, as more people have been cut off from recovery services, community connections, and the support of family and friends. And I'll refer you to the chart that's being passed out, which shows the annual increases in both the numbers and rates of opioid deaths over the past decade. And I'll note, Mr. President, that it doesn't even include 2022, which I just noted had 237 deaths from opioid overdoses. So as that chart shows, the number of Vermonters is increasing each year who are dying from overdoses from opioid use. It is a sad tragedy in our state. Vermont has previously been hailed as a state that is addressing the opioid crisis effectively, with the Blueprint for Health's hub and spoke opioid use disorder treatment system that has reached hundreds of Vermonters and been a national model for connecting people to primary care and treating people impacted by the opioid epidemic. But over the last several years, this system has been inadequate for reducing the number of overdose deaths. And it's become clear that especially as the drug supply has become more lethal with fentanyl and now xylazine, and drug use combinations are more complex and more lethal, that the spokes are breaking and more needs to be done. Last year, there were 2 bills aimed at substance use harm reduction that were vetoed and did not become law. But one bill did become law, Act 118, which established the Opioid Abatement Special Fund for the deposit of settlement funds from multiple legal settlements with pharmaceutical companies implicated in the opioid crisis. Over the next 18 years, Mr. President, Vermont expects to receive over $100 million in settlement funds that must be used for prevention, intervention, treatment, and recovery of opioid use disorder and deaths from opioid overdoses. Act 118 established the Opioid Settlement Advisory Committee, which met during the off session to take testimony and make recommendations for the use of Vermont's initial settlement funding. I am the Senate's representative to the committee, which also includes a member of the other body, the Commissioner of Health, who chairs the committee, and other members of the administration, representatives of local government, opioid treatment providers, and Vermonters with lived experience with opioid use disorder. That committee engaged in a lot of difficult conversations about what's working and what's not, and agreed that we needed to engage in a more innovative harm reduction approaches rather than punitive practices, and focus funding and efforts on saving lives right now, Mr. President. Much of the language in H222 and all of the funding provisions came out of the work of the advisory committee. So let's turn to the language of the bill, and with permission, Mr. President, I would like to speak to the bill as passed by the House and the amendments proposed by your Health and Welfare Committee. Is that all right, Mr. President?
You may.
Thank you. The bill has been handed out to each of us, and the amendment begins on page 1507 of today's calendar. So I will first go through the bill as passed by the House. We did make a few small changes to the language in the bill, but mostly what we did was add things to it. So if you'd like to follow along, you can look at the version as passed by the House to begin with. The first 5 sections of H222 as passed by the House deal with needle and syringe exchange and disposal programs, really updating these disposal and programs, adding needle and exchange disposal to drug disposal programs, and creating regional stakeholder meetings about public needle and syringe disposal programs, requiring both the Department of Health and the Blueprint for Health to facilitate these regional stakeholder meetings, and then make a presentation next year to the relevant committees on these stakeholder meetings. It also appropriates, and this is the one pot of money that does not come from the settlement funds. This comes from the Evidence-Based Education and Advertising Fund, to provide grants and consultations for municipalities, hospitals, community health centers, and other publicly available community needle and syringe disposal programs that participated in the stakeholder meetings. There is a pharmaceutical manufacturer fee increase in the House-passed version of the bill. Your Health and Welfare Committee removed that fee increase. And then there is a presentation next session from the Department of Health in consultation with stakeholders on looking at the unmet needle and syringe service needs, the resources required to ensure equitable access to these services, and who is best positioned to provide these services. There's a lot of discussion out in our communities about expanding access to these programs, about more organizations being involved in these programs. And there's equal amounts of concern from the Department of Health about the capacity of some programs to be able to handle needle and exchange programs and the implications involved with those programs. So this is really to get at a more in-depth conversation about what it takes to run these programs and who's most appropriate, all with the goal of expanding access to needle and syringe exchange programs. The next section, section 4 of the bill, deals with updates to existing laws regarding opioid antagonists. And opioid antagonists are a fancy name for the drug naloxone, which is known commonly as Narcan. And Narcan is one of our best defenses against opioid overdoses. It is easily administered and highly effective if administered in time. And so really what this section, Section 4 does is updates this to make access to Narcan and distribution of Narcan easier and more effective across our state. It requires that VDH update its training programs and education programs, and it also requires the Department of Health to distribute opioid antagonists or Narcan to assist those at risk of experiencing opioid related overdose, and also requires them to establish Narcan kiosks throughout the state places that are basically like little vending machines for Narcan. So people who may be at risk of overdose have easy access to them. And those would be in locations accessible where people who might be needing the Narcan. It removes the requirement that Department of Health may own, that a healthcare professional may only prescribe, dispense, and distribute Narcan to individuals who have received education. So saying these are really easy to utilize and to administer, and that was a hindrance to people who could use Narcan and have Narcan available for use. And it removes the requirement that individuals immediately call for emergency services after administering Narcan. There's a requirement in law that you have to call for emergency support after you've administered Narcan. That is not always necessary, and it's been people are often worried about doing that for fear of some kind of punishment, and so this would make it so you can administer Narcan, help somebody save their lives, and not be required to call emergency assistance if it's not necessary. Section 5 of the bill exempts other harm reduction supplies from the definition of drug paraphernalia. Drug paraphernalia is a term used in our criminal statutes, and we wanted to make sure it's clear that harm reduction supplies, including Narcan, were not considered drug paraphernalia. Section 6 of the bill prohibits a health insurer or other health benefit plans offered by an insurer or pharmacy benefit manager on behalf of an insurer from covering drugs that prohibits them from using what's called a fail-first protocol. Fail-first protocols are these protocols that are often required to make a patient prove that a medication is not effective for them or that they're having an allergic reaction to them. And the fail-first provisions make it really hard for someone to get another type of drug. And these are particularly applied to opioid use medications. So often a patient would have to literally show that the drug makes them break out in hives or vomit, and do so in front of their healthcare provider. So they would take the drug, show that it makes them throw up before the healthcare provider was permitted to say, this drug isn't working for you, this is making you sick, we're gonna give you another drug. So this provision prohibits a healthcare provider and health insurer from requiring a fail-first provision. Section 6 updates the phrase medication-assisted treatment for the medication of opioid disorder. That's mostly a technical change. Section 6B updates to the opioid use disorder treatment system to create greater flexibility in maintaining a regional system of opioid use disorder treatment. Uses more expansive language for who may dispense substances to treat opioid use disorder, including making it be healthcare providers more broadly instead of specifically physicians and registered nurses. It allows controlled substance for the use of opioid use disorder treatment to be prescribed via telehealth in accordance with federal regulations, and it prohibits the Department of Vermont Health Access or their pharmacy benefits manager from requiring a healthcare provider to document a patient's adverse reaction to a medication. This is the fail-first therapy, so they can't do that. This is the same provision for Medicaid-eligible patients. The second section is also, section 6C is also an update of just a Medicaid-assisted treatment to medication for opioid use disorder. Section 7 is about Medicaid use disorder medication, and it requires the Agency of Human Services to provide coverage to Medicaid beneficiaries for medically necessary medication for opioid use disorder when prescribed by a healthcare professional practicing within their scope of professional license and participating in the Medicaid program. And pending approval by the Drug Use Review Board, it requires AHS to cover at least one medication in each therapeutic class for methadone, buprenorphine, and naloxone as listed on the Medicaid's preferred drug. This just expands the number of effective drugs that can be used for people who are experiencing opioid use disorder and are on Medicaid. Right now, it's very limited what people who are on Medicaid can get prescribed to treat their illness of opioid use disorder. And this makes it much easier for them after the rules are in place. It's really just been a horrible situation for people who are on Medicaid, not being able to get the drugs that they need, the medications they need to treat their illness. And similarly, Section 8 and Section 8A and 8B, so the next 3 sections all deal with prior authorization. As you might know, prior authorization is a method that's used mostly by health insurance companies to require that a patient get prior authorization from a physician before getting medication assistance or other kinds of medical treatment. This softens or makes more flexibility in the prior authorizations, and it requires DVHA, or Department of Vermont Health Access, in consultations with individuals representing a diverse professional perspective, to research the feasibility and cost of administering a gold card program for substance use disorder. A gold card program is a program in which a healthcare provider, if they have had more than 90% of their prior authorizations approved in the past year, then they would qualify for a gold card, which means that they would not have to seek a prior authorization before prescribing a medication. It implements rulemaking for this as well. So this section is really important for people to have access to the medications they need. And the next section also directs DVHA to amend its rules to enable healthcare providers in an office space commonly used medications to treat opioid use disorder, and this would eliminate the prior authorization up to 24 milligrams. The next is about recovery residences. Right now, the zoning requirements for recovery residents are quite strict, and this would require that all municipalities, in all municipalities, a recovery residence serving not more than 8 individuals be considered by right to constitute a permitted single-family residence for that property. This is consistent with other supported housing regulations, and it would make it easier for recovery housing to be created and maintained in all of our communities. Recovery housing is crucial for people who are trying to overcome opioid use disorder. The next section, Section 10, repeals the buprenorphine sunset. For those of us who were here last session, you might recall that we decriminalized the possession of a small amount, 224 milligrams or less of buprenorphine. We decriminalized it, but we set a sunset for that. And the sunset was June 30th of 2023, I believe, this year. It was a 2-year sort of pilot to make sure that this provision wouldn't lead to any adverse outcomes. There was a report back that we received in March, I believe, and that report basically said that there were not any adverse implications from decriminalizing this small amount of buprenorphine. So this removes the sunset. There are provisions for people under the age of 21 and under the age of 16. If they are possess this amount of buprenorphine, they would be referred to either the court diversion program or the family division of the Superior Court. So there are special provisions for juveniles for this. But this was found to be not harmful and also a part of an effective tool in the toolbox against the opioid crisis. Okay, so that is basically the bill as it came to us from the House. And now I will talk about the amendment from your Health and Welfare Committee, which can be found on page 1507 of today's calendar. So as I said, we made some very small changes to the language that the House sent over to us, just mostly technical changes in the language that were requested from the Department of Health, and then some rulemaking changes about the use of buprenorphine. But the most significant things we did was we added some provisions. Mostly we added all of the funding recommendations that came to the General Assembly from the opioid advisories, the Opioid Settlement Advisory Committee. And we also added a provision about drug checking programs. And drug checking programs are programs that there is already a program that exists in Vermont. It's a pilot program that exists in Brattleboro and also covers parts of Bennington County as well. And this is a program for people to bring small amounts of illicit substances to a program to be tested for to find out what is in their small sample of a substance. And the reason this is really important, as I said at the beginning of my presentation, the drug supply, the illicit drug supply is becoming more and more deadly. And people do not know what's in the drugs that they are obtaining. They think it's just a straight opioid, but most of the supply now includes fentanyl, which is highly deadly in small amounts. It also includes xylazine. And some people who are not even using opioids, they're using stimulants, are getting stimulants like cocaine lined with fentanyl. And so they think they're getting one thing and they're using it in a way that they have in the past, and it's killing them immediately or very quickly because it has so much of the very, very strong fentanyl